Alors, mesdames, messieurs, chers collègues, bienvenue à cette conférence de presse pour faire le point sur la situation au Québec quant à la COVID-19. Le premier ministre du Québec, M. François Legault, comme d'habitude accompagné de la ministre de la Santé et des Services sociaux, Mme Danielle McCann, et du directeur national de santé publique, Dr. Horacio Arruda. Alors, Monsieur le premier ministre, à vous la parole.
Merci beaucoup. Bonjour tout le monde. Je commence avec le bilan du jour. On a 41 nouveaux décès, donc un total de 216 décès. Je veux bien sûr offrir mes condoléances à toutes les familles et les proches.
The families and the loved ones of those victims. We have now 10,912 confirmed cases, an increase of 891. We have 679 people who are hospitalized, that is an increase of 47. We have 196 six people in intensive care, an increase of 15. So as you can see, the number of deaths is important. We were expecting it, however, that goes along with the predictions. And we have to be aware of the fact that we have a few days left before getting to the peak. So unfortunately, we are expecting to see more increases over the next few days, and then it should decrease. So we are aligned with our predictions. However, we still have to mention the good news. When we look at the hospitalization rate and the number of people in intensive care, we are exactly aligned with our predictions, which show that we are getting close to the peak. So it's a good stabilization in those increases of the number of people, whether it be in intensive care or in hospitalizations. One thing that is important to mention, when you look at the 216 deaths that we've had up until now, 90% of the people were 70 years of age and over, and 9% were between 60 and 69 years of age. So that means that 99% of those deaths are people of 60 years of age and over. So that does mean, on the one hand, that it's reassuring for the younger people, but obviously it also shows us where we have to put our attention. That is, we have to put our attention in the older people, and I include myself in that because I'm 62. And however, that is a good news. That's what I'm being told. In those people who die between 60 and 69 years of age, almost all of those people had chronic illnesses. So that means that you are in good health, as I am, between 60 and 69 years of age. There's no reason to worry. However, and that's where it's going to be really important to take things over the next few weeks, yes, we're looking at reopening businesses. However, even if people who will be working in those businesses are not at risk of serious consequences following the disease, they could put other people at risk. So it is going to be very important in the upcoming weeks and months that all people who are younger than 60 or 70 be very careful to not go close to the elderly. So that is something that we have to understand for the next few weeks and months, and everybody has to keep that in mind. Those people who are vulnerable are the people who are older. They don't have more or less chance of getting infected, but there's more probability, if they do get infected, that they will have more serious consequences leading up to death. So we have to be very prudent. I will never say it enough. We have to continue repeating it. People who are older should stay home, and unfortunately, we can't go visit them. We can't go closer to those people, less than 2 meters away, and don't stay for a long time in their presence. Of course, that is for the people who are in homes. I'd like to come back to residences and CHSLDs. I know that a lot of people are worried with the present situation in CHSLDs, but I want to, and I've asked a lot of questions myself for the past few days, to Danielle's team as much as Dr. Arruda's team, and what we can see is that the problem truly is in a few CHSLDs. There are 6 CHSLDs where most of the deaths have taken place, and that is where the situation is critical. So that is to say that it's important to name them, and I know that we've been careful not to name them, but we can see them pretty much in the media. So it is important, and I made the choice of naming them today. So there is the CHSLD of Sainte-Dorothée in Laval, the Centre d'hébergement Notre-Dame de la Merci in Montreal, the La Salle Housing Center in La Salle in Montreal. There's the Alfred Desrochers Housing Center in Montreal. There's the La Flèche CHSLD in the Mauricie region, if I remember correctly, either Shawinigan or Grand-Mère. And there's the Lapinière CHSLD in Laval. So that is where most of the deaths have taken place, and that is where the critical situation is. That is where we're working really hard. However, we also like to, do prevention work in other places. Danielle made sure just in the course of the past few days in CHSLDs, we added 450 doctors and 1,000 nurses and other health staff. So we really are making a lot of effort to concentrate there because that is where things are happening right now. Maybe a couple of clarifications. First of all, there are very clear rules. All the staff in CHSLDs, when they come 2 meters away or less from a resident or a patient, they have to wear a mask. So that is clear. When the guidelines are clear, when the staff comes close to a patient, closer to 2 meters, they must always wear a mask. And the other thing that it is important to say, because we have to reassure the family that who have residents who are not in one of those 6 critical CHSLDs, when there is a case of COVID-19, the families are called. That is the guideline that's been given. The families have to be called. So if you haven't been called, it's because there are no cases of COVID-19. The other thing that's good news again today, you know that we had already announced that for private housing centers, there were a lot of people who didn't make a lot of money. We had already announced that we were granting an increase of $4 an hour paid by the government to the attendants and orderlies. We had also announced in the entire public network an increase of 8% for nurses and nursing assistants and of 4% for the rest of the staff. As of today, and retroactively to the 13th of March, the same premium will also take place in private residences. So that means nurses, nursing assistants in CHSLDs that are private and in private residences as well will also get that 8%. The other employees, 4%. And we're keeping the $4 an hour premium, which is pretty important for people who only made $13 or $14 or $15 an hour. So that all remains in place. So, of course, I think that these are premiums that are very well deserved by the staff in those private residences. And we wish to thank them at the same time. Speaking of thanks, my daily thanks. And perhaps I'm going to be a little bit different today. Rather than thanking, I want to give a homage to our elderly. We have a duty to remember our elderly. They built Quebec. It is they who went through burdens. They are the ones who are leaving to us the legacy of a society that is more fair, more rich, more beautiful, and we have a duty to protect them. So I want it to become the priority of all Quebecers. Protect our elderly. Pay tribute to them. They deserve that. And I want to take advantage, of course, of this opportunity to salute them. I know that you are going through a difficult situation. There are many people who are alone at home. And now, I'm not necessarily announcing good news by saying that it's going to last longer, that, this confinement is going to keep going on for a while. So I wish to thank you, and I wish to tell you that we're with you. To end with, I would like to say that on Saturday, as usual, the Deputy Premier is going to be replacing me, and on Sunday, we're going to have a day off, taking into account that we hope that the crisis is going to be toning down. We're going to start taking a few days to come back as well to kind of normality. But I would like to come back to the most important guideline as far as I'm concerned. Let's be careful with our elderly. Let's take care of them. I know that it's Easter over the weekend. Don't go visit our parents, our grandparents. Do what I do. I'm not going to go see my mother on Sunday in Sainte-Anne-de-Bellevue, but I'm going to call her. So, Mom, I'll call you. And I would invite everybody to do that with their parents and grandparents. You're not going to go see them over the weekend, but you will call them. Thank you. A few words in English?
Good afternoon. I know there's a lot of concern about senior residences at the moment, but I don't want Quebecers to think that the situation is critical everywhere. There are 6 public residences where the situation is critical, and that's where the majority of deaths occur. So we concentrate our efforts there, but we're also doing everything we can to prevent the contagion in other residences as well. Because protecting the elderly remains our top priority. So it's Easter this weekend. I'm asking you not to visit your parents, but please call them. Thank you all.
Merci, Monsieur le Premier Ministre. Alors,
thank you, Mr. Premier. So for the question period in French, we will be starting today with André Martin. Yes, hello to all 3 of you. I know that the number of deaths in CHSLDs is something that concerns you, and I think that it concerns all Quebecers as well. Could you give us an idea of the number of deaths concretely in CHSLDs as opposed to in hospitals, please? Well, in CHSLDs right now we have 106 that have been reported. So these are people who were originally in a CHSLD. A proportion of those did go to the hospital. I think that it's important to understand. So what we have here is the origin of the people. It's not everybody in a CHSLD who necessarily go to the hospital, but a few did. So 49% of people come from CHSLDs, and then 22% come directly from home, 22% residences for the elderly, and 2% who were in hospital settings already. And a 5% that's unknown, but it's still, in CHSLDs that we have the maximum number of people who died, because that is also where we have the people with the most illnesses, the most chronic diseases, as well as other kinds of diseases. Why then can the closed or the families can still visit them in CHSLDs? Shouldn't we have forbidden them? Because I think that for humanitarian reasons it's still allowed in certain places. Why didn't you ban them earlier in your strategy? Well, I just want to tell you that very early on we banned visits in those centers for the elderly. There is one exception, and that is for people who will be dying. There are at the end of their lives. I think that it wouldn't be human to say to a child, you can't see your father or your mother for the last time. We take the necessary precautions, but I think that it's simply a question of humanity. Would it be possible to have specifications on the 6 CHSLDs that you mentioned? That is to say, how many deaths are in each? Because you said that these are the critical places. How many deaths in each of them? How many people were tested positive? Do you have any data about this? Yes. CHSLD at Sainte-Dorothée, 16. Notre-Dame de la Merci, deaths, yes. Notre-Dame de la Merci, 13. La Salle, 7. Alfred Desrochers, 5. La Flèche, 20. And La Pinière, 10. Yesterday, you created a sort of movement of optimism in the construction industry, Mr. Legault, in the sense that you said that, well, perhaps we could reopen by keeping certain measures of distancing. I was told that there are companies in the construction that were submerged by calls from clients yesterday. Could you be more specific on the one hand on the timeline where you will allow for this industry to be reopened? You've already qualified it as being essential for the economic support of the Quebec economy. Well, now we're planning in the next few days to get to the peak, so we have to make sure that that is the case, so that the numbers, keep going the way that they are. It's been a few days that those hospital numbers have held. I should have started by saying I also need Dr. Arruda's okay, I'm working hard on that. But that is why today I was saying that 99% of the deaths are in people who are 60 years and over. So if younger people go work in a construction site, as long as they don't go anywhere close to people who are 60 and over, I think that the risks are limited. So, of course, we are going to be following in the next few days the evolution of the data. We will continue having discussions, but I believe that we still have to start thinking of the fact that, we can see the unemployment numbers, the hundreds of thousands of Quebecers who are going to be having or are having financial problems. So if there isn't too much risk, we have to be able to reopen things, staying 2 meters away from people. So that is what we will be following in the next few days, and then we'll be giving ourselves a plan. And at the beginning, we're going to concentrate on those companies where people are able to stay 2 meters away from one another. So you just spoke about it. I think we are to understand that the deconfinement that you're planning for will be targeted using the elderly. So the elderly might be confined longer, if I understand. Or are you thinking about a more regional deconfinement? Well, we've talked about that a lot. I'm starting to be a specialist in public health. I asked the question, since Montreal is perhaps already at the peak, are we starting with Montreal or the regions? And the first answer was that's a very good question. But what I've understood is that since there are more cases in Montreal, even if we start going on the downward curve, we may have more cases than those who haven't yet reached the peak in certain regions. So we still need to have more data to be able to answer that question. That's what I understood, right? Well, yes, but if you'll allow me, your question is pertinent. We ask ourselves that question every day, but I would like to say one thing. Of course, as the National Director of Public Health, I'm also concerned by the health determinants that say, that people are healthy. That means economy, that means labor. But you have to be careful. We put a pause very quickly, immediately, a very courageous decision on the part of our Premier. Well, this recovery has to be progressive with, a thermostat, like a dimmer and a light, because the danger is that not everybody was infected. If everybody starts going all over the place and going out all over the place, we're going to have another peak, a peak that we would have avoided now, but then it would come back later. And also, we could get to a second wave. You remember SARS in Toronto, that the government was reproached and was not reelected, And it's not just a political question. Even people of public health were questioned on that. It's because they had thought that everything was back to normal, and it came back with a very, very incredible peak. And the WHO, the World Health Organization, all organizations that work in the health domain are telling us to be careful with that. And in other countries where they had the epidemic much before us, they are just starting to reopen, but nobody is going from off to on. You need to go with specific surveillance conditions and monitoring conditions. And of course, we're going to be opening those places that are essential to the functioning of the society and that will go with the respect of certain conditions. So don't interpret the reopening of the economy in certain sectors as being, okay, let's all go back to exactly how we were before. That would be dangerous. And there are sectors where there's going to be a lot of, we're going to have to be very careful, like big buildings. We don't want to take any chances because it's impossible, unless somebody guarantees it to me, that there's not going to be any contact with older people. The more we are in confinement, the more people are going to be tired, the more they're going to be, they're going to want to slacken their measures. But I want to invite Quebecers to understand that message because they've been extraordinary until now. Over Easter and Passover, we can't get together. The Premier has said it, but we want to reopen it. The light will be coming at the end of the tunnel, and we're going to do a sectoral analysis, a regional analysis, and we're going to be emitting recommendations to our Premier who will be able to make the necessary decisions. So you talked about the 2 meters distancing for professionals. So you're going to prioritize those professions where they can keep their employees 2 meters away. What will happen with the places to work where you have to be close? I'm thinking about physiotherapists, I'm thinking about, people, hairdressers. Well, of course, it's more difficult if you want to keep 2 meters and you're a hairdresser. It's pretty hard. So that means that will come later. The other criteria that is also very important is how old is the person that is the client and the hairdresser. I want to come back to the fact that 90% of deaths are in people who are 70 and over, 99, 60 and over. So I'm thinking about the children in schools and daycares. Yes, there are risks that they are going to get infected, but the risks that they will have serious consequences are very low. I would like to go back to the question that I asked you yesterday, Ms. McCann, particularly concerning the non-respect of the health protocols in elderly residences for the staff from the CHUS who go and deliver home care. So there's one question that I got concerning what is said in the press conference by the Premier or a minister. Be prudent with that information. We work only with the official communiques that are sent to us by the CHUS. So be prudent with the information that you give us. Is that what it is? Or the information, the guidelines that you give don't get to the CHUS? So, the protocols aren't followed? Well, I did have the opportunity of talking with the general directors a couple of hours ago. And to remind them that the residences for the elderly are taking important measures to protect their clientele, and those guidelines have to be respected. So that is what was said to the managers and directors, and I think that it has to be applied in the field. So when you arrive in a residence for the elderly, an autonomous one, you have to follow the protocol that has been set up by the residents, which is very safe, and you follow that protocol in all regions of Quebec. It's important. These are important partners, and this clientele is very important, the people who live there. And I would go even further. We gave a budget to increase the resources. We want for the CIS and the CIUS to help the residences in autonomous, for the autonomous elderly, to hire people and including a nurse to see everything having to do with the prevention of infections, that all that be respected. So we work a lot with them, and that will intensify. I would like to take an example that was given to me by a manager He has 1,000 under his responsibility in the Lanaudière region, and as is current, there is one ambulance that goes per day. Average statistic, those people are often hospitalized for health problems, and then they come back to their residence. And sometimes the CIS informs a week after that person was in contact with people who had been contaminated, healthcare workers who were contaminated. And professionals or managers are asking that there be a buffer zone so that people will not be reintegrated in the residences for the elderly. Would it be possible to send those people for 14 days at the hotel, for example, so that we have the time to test? Well, what I'd like to say, there are guidelines that are, current right now, where we say that for screening, for the people who go back to where they live, whether it be an RPA, an CHSLD, or regardless, they had to be tested and they have to be negative before they reintegrate that place where they live. That's the first criteria for the screening that we're giving ourselves right now in order to avoid contagion. Another thing that we're saying is that we screen all residents and all staff in CHSLDs or where they live, any of those places that may have one confirmed case. We have many in Quebec, so all residents, all the staff will be screened. And if there's any other indications given to us by public health, we will do the screening there as well. So all of that is implemented already, and these are the rules that we've given ourselves to avoid contagion where the elderly live.
Bonjour à tous.
Hello, everyone. Justin Trudeau said earlier on today that we're not going to be going back to normal before a vaccine is created. He estimated that to being a year and a half. At the beginning of the crisis, Mr. Legault, you talked to us about borders. I'd like to go back to that. Do you plan on asking for the borders to remain closed during that period to avoid that travelers bring back the virus? Well, we're not yet at the stage of reopening. Will we be, and when? Well, the questions will be asked as we go along. But of course, as I was saying yesterday, normal life, where we can hug and kiss one's grandmother or mother, that's not going to happen tomorrow. It's going to take months. But the question of borders, well, that will be part of the subjects that will be talked about over the next few weeks and months. I will ask public health what they think about this. Well, listen, you have to understand, as the Premier said, we'll study this and we'll look at it in function of the epidemiology that is happening elsewhere. Right now, there's New York where things are very, very much a hot zone. So I think it's a question that's very interesting because, it will be part of everything that we'll be planning on. And we can't also think that we're going to avoid every single case. We're going to accept a certain community transmission so that it integrates over time. But we'll also always evaluate the balance of risks of reopening as compared to the potential epidemic context. And of course, at some point, people can't think that society is going to stop functioning for a year and a half. It will come back to a certain level of normalcy, but the arrival of a vaccine and as well as medication will help to be able to help people and avoid death. So yes, this will be studied. The reintroduction of the virus through traveling from the outside, the capacity of Quebec to contain, because also what we don't want is to have another wave in the fall and that the health system be overwhelmed. Don't forget that what we've done is to make sure that we don't end up in a situation like in Italy, where we would have not had enough room to care for people. We did it so well that we did lower the curve, but we can't lose that by going too quickly and that it go back up, and that we just have delayed things, lowered, and then it all comes back in the fall, and then that we lose everything that we've acquired through the sacrifice that we've asked of all Quebecers of distancing as well as loss of economy. There are doctors in private practice that would like to come help out their colleagues in public, but they're saying that the present rules don't allow them to do it without abandoning their patients in the private sector. First, do we need those doctors, or do we have enough? And second, couldn't we change the rules so that they don't have to abandon their patients in the private sector? Well, I think that we'll be studying that because we need everybody, so I cannot presume. But what I can tell you is that we will study that certainly very seriously. We were saying yesterday that we have 450 family doctors who are ready. They are helping us out in CHSLDs. I'm even talking with the president of the FMSQ who asked to speak to me for a contribution of specialist doctors in CHSLDs. And I'd like to take advantage of this opportunity to talk to you about something that I've heard in the media lately about the transfer of people in CHSLDs towards hospital centers. When we're talking about the doctors that come and help us out, doctors have a very important role in CHSLDs. But what I want to tell you today is that when a person is in a CHSLD and that person needs treatments in a hospital center, we transfer that person. Of course, there are discussions with the family doctor. There's an evaluation made. We also take into account the level of care because you know that there are 4 levels of care. There's 2 where people ask to have care of intubation in a hospital setting, but there's 2 other levels of care where people ask to not have these extraordinary measures and they want to have comfort care. So it's possible that in CHSLDs there are levels of care where people say, well, listen, I don't want to be intubated if my state deteriorates. So the people who are in CHSLDs are people who are very ill. But what I want to tell you today to really, so that it's clear, because what we can see in the media right now is that in no way do we prevent the transfer of people towards hospital centers. People in CHSLDs, people who need care, and that is evaluated together with a doctor, are sent to hospital centers. And there's many that were transferred to hospital care to be treated. So I want to make that clarification today. It's very important. We care for our people who are in CHSLDs. From what we've heard, the management of the equipment in CHSLDs at Cedroté, for example, is pretty chaotic. We can imagine that it's like that elsewhere. When you were saying things are okay right now in the hospitals, we're also speaking of CHSLDs, and could you also tell us how it's going on in CHSLDs? Is it enough equipment? Are we correcting things? Because there's a massive redeployment towards those establishments. What I can tell you is that I talked to the general manager a couple of hours ago, and the CEO that takes care of the outbreak situations, like at La Flèche, like in Laval as well, and even in Montreal. And all have told me that they have added staff. The situation is not easy, but they have added. They have the correct, the protective equipment, and they're trying to organize as much as possible that it be the same person giving the care to the patients. That is to say that people don't go from one unit to another or from one establishment to another. And the protective equipment is there. We have the screening and setting up screening throughout those establishments, all of them, as I mentioned to you. It's not an easy situation. But there is reinforcement coming, doctors and probably specialists as well. So we have an entire team. We have 1,000 more people in CHSLDs right now, and there will be more as well. So we are truly taking charge of the situation, and we are making every effort so that it be a situation that is going to be as normal as possible. With what Justin Trudeau said earlier on about the vaccination, that is going to take some time. With what you said yesterday, we understand that we're not going to be having any fun before a certain while, and we are social animals. What are you going to do to contain the population that is already starting to be impatient, and the summer is coming and people are going to want to get together? What is your plan to do that? Well, listen, it's serious. It's serious. There's deaths. I don't think I need to explain that to anybody. But yes, we're going to be reopening companies and businesses, and yes, at some point we're going to be reopening schools. But to be able to be 200 and 2,000 people in a room stuck against one another, that's not going to take place tomorrow morning. Yes, it's too bad, but at some point we're going to have to take the necessary measures so that there's as few deaths as possible. I trust the good judgment of Quebecers. When I see up until now how Quebecers have reacted, I think that they've been responsible, they've been disciplined. There are things that we'll be able to start doing again, but not everything. And we're going to have to get used to it for a certain number of months to keep that distance with other people.
Prochaine question, Hugo Pilon-Larose, La Presse.
Bonjour. Vous demandez justement aux personnes âgées.
You were asking the elderly to stay home, to not get any visitors. Should we understand that this is going to be for the next few months until we have medication that can treat the virus or a vaccine? And does that mean for the elderly who are at home and who are listening to us right now that they're going to spend the entire summer in their living room, that they're not going to be able to have barbecues with their families and see their grandchildren? Well, we've said it many times. Having a walk while staying 2 meters away from other people is good for mental health, is good for physical health. So maybe we're going to have to find activities like that. But it will be very important in the next few months that people who are over 60 years of age or over 70 years of age be careful to not be less than 2 meters away from other people. Because yes, we'll have reached the peak, but we'll still have contagion once we go down the hill. So the people who are vulnerable, unfortunately, are those people who are older. I think that we have perhaps a possibility of organizing activities, but while respecting distance.
Madame la ministre de la Santé, on vous a interrogé par le
Ms.
passé.
McCann, you were asked in the past about the guideline for public health that allows to bring back certain employees at work after a period of isolation of 7 days. And you had said that it was in exceptional circumstances to ensure that there not be any break in service. But what is, or breach of service, but what is most dangerous for human life? A breach of service or employees who come back and spread the virus? Well, first of all, people can't have symptoms. That's obvious. There is nobody who's going to go back to work if they have symptoms. The other thing is we test them. We said that we would test any person that is in a housing center where there's at least one confirmed case. So all those who are in outbreaks right now, they're all being tested or will be very shortly. But in my opinion, they've all been tested. But for others, as soon as there is one confirmed case, we'll be testing. So the people who are going to want to come back to work or who will be able to come back to work will be tested as well. So that is a protective measure, an additional one that we're giving ourselves. And I would like to add that when that happened in the past, that somebody would get to work or would come back to work after 7 days, there were protective measures, very important ones. Procedural masks, taking the temperature twice a day. But in fact, these were extremely exceptional situations. It was not at all something that we did often. There was a danger in a breach of service. But what I'm saying right now is that we're going to be testing everybody in CHSLDs where there are at least one confirmed cases. Everybody will be screened.
Monsieur Legault, dans votre esprit, est-ce que...
In your mind, Mr. Legault, reopening schools, could that be done regionally? Or is it going to be an all or nothing? Well, nothing will be excluded. I like to repeat it. For children, the risks of serious consequences are very low if ever they caught COVID-19. Of course, we're going to be having discussions with Dr. Arruda of Public Health to see what the situation in each of the regions is. So we're not excluding it to go regionally, but it's also possible that we'll be able to open everything at once. And if you allow me, your answer is excellent, Mr. Premier. I would like to also say it's important that we continue maintaining things, but it's also important that you understand that we're not going to stay confined like this for months and months. We're going to be reopening certain activities. We're going to even be accepting certain local transmissions. What we don't want is to have an overwhelmed healthcare system that can't treat people. What we don't want is people to die because they didn't know that they were going to be exposed to danger. But I don't want you to think right now that even if we have a vaccine only in 18 months or in 12 months, that society is going to remain confined like this. People will go crazy anyway. It won't be possible to do so. But in function of what we will observe in terms of epidemiology and the grade of it, and we'll be able to reopen. We closed in one shot. We can't reopen in one shot. We have to open, measuring what's happening and giving ourselves a capacity. I don't want you to be hopeless, but I want to ask you that in the following weeks we still be very prudent and that we understand the guidelines. In each decision that we make, we balance that out. Because, if we end up with depressions or suicides, people who divorce because they've lost their capacity to live, well, it's not going to be any better, than the infectious disease. But we have to have balance. And in order to not lose everything that we've acquired with this decision that the Premier had the courage to take, we have to do it. We have to do it with a graduated plan that will accelerate. At one point, we will go back to being a stronger society, in my opinion, hoping that will have diminished the main impacts on the death toll. Ms. McCann, I know that we spoke about offering workers of CHSLDs to be able to live in hotels. Where is that at now? Is this something that people had been enthusiastic about, or is nobody using it? Well, it's still a possibility. Listen, not only, I'll tell you, I'd like to take advantage to say the following, not only for workers, but even for the residents. In the western part of the island, there is a hotel that was used for certain residents in order to have a larger space in a CHSLD and for certain residents who were not ill with COVID-19 to be there. For the workers, it's still a possibility. So it's open. If people want to use it, we can organize it. Right now, I don't think that it's something that is very used, but it's certainly a possibility. If there are workers who require it, who wish for it, it's not everybody, of course, because you know that somebody who is a single parent, they want to go home, of course, but there could be workers who might wish it, and we're very open to that possibility. Now, a question from a media not represented here.
Elle nous a été envoyée aujourd'hui par Henri Ouellet-Vézina du journal Métro. Donc, pour M. Legault,
For Mr. Legault, many people who did not renew their lease before the beginning of the pandemic are scared of not having an apartment or a place to live. Does the government have a plan to protect those people or to renew or make the leases last longer? Well, first of all, the checks of $2,000 have started being distributed by the federal government, so it's possible for people to pay their rent. Now, we're following the situation very closely. André Laforêt, the Minister for Municipal Affairs and Housing, is following the situation very closely, the housing situation in each region of Quebec. And there will be a domino effect depending on when we start construction back up. For those who were supposed to move, we know that in Quebec it's a lot of moves around the 1st of July. So that is part of what we're following. It is perhaps a little early to talk about measures. In certain cases, are we going to delay moves? Are we going to prolong the leases? We're not there yet, but we're not excluding anything, and we'll be looking at that over the next few weeks. Thank you. That completes our French questions.
We'll start today with Katsuni from CBC News.
Good afternoon. The Festival d'été de Québec and the Festif in Charlevoix confirmed they are cancelling their festivals, their summer editions. There will be other cancellations, of course, in the near future across Quebec. So what will be done, because these events are so important for the economy.
Yeah.
So what will be done to help those regions and for those lovers of music and shows?
Yeah, I spoke to Minister of Culture, Nathalie Roy, Minister of Tourism, Caroline Proulx, and we understand very well the bad situation they have to live, and maybe for more months than many other types of enterprises. So it'll be tough. We'll help them when the right time will come, when we'll be able again to put many people together. We'll help them financially. It's very important for our population, culture, having fun together. It's important for a society. So at the right time, we'll help them financially.
C'est possible de répéter en français sur ce sujet-là.
Could you repeat that in French, please? Yes, well, listen, of course, I understand that the situation is very difficult for all activities that usually take place in the summer, and I'm thinking about the festivals, for example. We understand that it will take a certain number of months before we are able to authorize any gatherings of many people. But it's important for our society, it's important for our culture, it's important for, our joie de vivre. So when we'll be able to start those activities again, there will be help that will be given. Already, Nathalie Roy, the Minister of Culture, and the Minister of Tourism, Caroline Proulx, are working at all sorts of different plans according to different scenarios for when we'll be able to start those activities again, things like festivals.
I would like to go back to testing. You explained to us earlier this week that we were missing the reagent, these chemical substance to make those analyses, and then we had this issue going on. And then when we look at the number of tests that are done, there was a reduction this week, and now we're a bit more than 5,000 tests. But to my knowledge, I had an impression that we had a capacity way higher than this per day, Mr. Arruda.
It's going to come back, I would say, higherly. The reactive issue is something that is solving, actually, and there's going to be new kind of tests that are trying to be in the next time, even the ones that are going to be able to be done and have an answer 15 minutes afterwards. I would just remember that we are probably in Canada one of the ones who are going the most quantity of tests, actually. And that will be corrected, and we will use test, which is part of the strategy that we need to do. Actually, we are concentrating a lot of our energy on CHSLD, where the long-term care facilities where people are dying, and it's important to make sure that the personnel and that the people are being tested. But this will get up as soon as we will maintain. We have about a capacity of 6,000 tests now. It's going to be higher and higher in the next days, and we will make sure that we use tests as a capacity. But I would say that hopefully the reactive issue is no more a problem. We had a recipe coming from Winnipeg that we had from France that will make us able to do our own reactive.
Next question, Samuel Pouliot, CTV News.
Yesterday, you announced that all staff and residents in CHSLDs will be tested. The CIUS West de Lille says it's too early to know how that would be feasible to do. So when will people start being tested in CHSLDs, and how will the testing be managed?
Well, we will start, as I said just before in French, that we'll start with the long-term facilities where there is a suspected case. So we'll start with those for obvious reasons, and we'll test all the residents and all the staff. So this is being implemented right now.
Okay, and when businesses reopen, how will you ensure that they maintain physical distancing? And when we talk about restaurants, for example, and people, the same family goes on the same table, how will the restaurant management know whenever people are really in the same are in the same household?
Okay, so the reopening will be done gradually. So we'll start with businesses where the employees can stay at least 2 meters from other employees. So that's why if we talk, for example, about restaurants, they won't be in the first step. It will take more time for the restaurant to be reopened.
May I add something? We are working with the SNEST, which is the Commission of Working, to make sure that we will give to the ones who have to open what are the criteria. And we have inspectors of health and inspectors of, I would say, milieu du travail. And those, if people don't respect things, can even use, I would say, fines and penalties. We don't want to be a penalty kind of approach, but we will make sure that people know what to do, what are exactly in their sector the recommendations that are going to be made, and if there is issues with the application of that, it's clear that the inspector of the SNES are going to be able to make sure, stop things or give penalties.
Thank you. Now, a question sent by email from Phil Autier, Montreal Gazette, for Mr. Legault and Arruda. Yesterday, you said the rules of social distancing would have to continue for a while. We know this virus can move in waves. Are you able to say today which activities Quebecers will be able to do and when, as the peak passes, open schools, go to a park together, show real estate?
We have discussion right now with Dr. Arruda about a plan of reopening. Of course, in the different criteria we'll use, first there'll be this 2 meters. Can we operate in respecting the 2 meters of distance between people? Of course, we'll take into consideration also the age of the population. As I said before, 99% of the deaths we had already are all people over 60 years old. So, of course, it's different when you talk about being close to somebody older and somebody younger. So it's all the kind of discussion we have, and we hope soon to be able to present a plan of reopening with different sectors.
I would say also, if you may, Prime Minister, that we are working on that since a month. Don't think we are it's an improvisation. We are looking what is going to do here, the data, where are we on the curve, and also what are the best practices in the world about this. So that's not an improvisation, but it's clear. As we have shut down enough, we need an interrupter for light directly, actually, and we will making sure balancing the impact on the economy and also the health impact.
Thank you. Now, second question for Phil. Montreal health officials say the peak of the epidemic will be here in the next few days, and we could see provincial peak April 18. Can you tell us what the peak will look like in terms of hospitals, long-term care centers, death?
But you all have that in the forecast that had been tabled a few days ago. So, of course, in Montreal, you have more cases, but at the same time, we're closer to the peak. So you have to take that into consideration. There's no exact numbers, but you can have good forecasts in the documents that have been tabled.
Thank you. Now a question from Raquel Fletcher, Global News, for Dr. Arruda or Minister McCann. Can you elaborate on your thinking about antibody tests, blood tests, to see how many people may be immune to this virus? Wouldn't that give us invaluable information about how to proceed in the next year and a half while we await a vaccine?
That's a very interesting question, and that's the case. We want to do seroprevalence studies to does Montreal has been infected 10%, 20%, 30%? We know that we have tested a lot of people, but that is not enough. So as any other country, and as in Canada, we are going to do those kinds of studies, actually. It's going to be done everywhere, I would say in Quebec by a sample, meteorologic sample, but also in prospectively in different regions to best appreciate what is going to be the next wave, if there's going to be one. If it's very different if 80% of the population have been infected compared to 10%.
Thank you. And as a very last question, you are not currently testing people at the end of their illness. What if after 14 days have passed, they still have the virus without symptoms?
In fact, it's mostly, and we are learning a lot, like this transmission before getting the disease is something relatively new. At the beginning, we didn't say that, but now there is more and more information about this. In fact, but even if it's not a guarantee of 100%, I would say the probability of somebody who has no symptoms for 14 days, even if he had a little bit of virus, is not going to be very infectious. That's almost what we can say, actually. And I think that's probably that which is the situation. It doesn't mean that you don't have any virus. It doesn't mean if you test you could not have any reaction. But the quantity of the virus that you're going to excrete will not be enough to contaminate a lot.
Thank you very much. That's all the time we have. C'est tout le temps que nous avons. Merci. À demain.
Merci.